In today's COVID-19 update, Health Minister Dr. Frank Anthony expresses concern over growing number of COVID-19 cases in the country, and the Pfizer vaccine arrives today. Minister Anthony, thank you so much for joining us today.
Well, thank you very much for having me.
Yes, sir. Uh, right off the bat, the shipment of Sputnik V second dose that we received yesterday, I just wanted to ask you: have those been already have those been distributed, and are persons still having to make an appointment for their vaccine?
Well, when we get it, what we have been doing, because we're getting limited quantities, on average we're getting like 5,000 a week. So once we get it, we then allocate it by different regions, because there are people in all the regions who would have received their Sputnik first dose. So we're trying to make sure that those who got first dose, say in region 1 or 9, they too would be able to get their second dose. So we have an allocation mechanism that we distribute out to the different regions, so that persons in those regions can have access to the vaccine. We've just received 5,000 doses. We have started this morning to give those doses out, and I hope people can bear with us. We understand the anxiety, but as soon as we get these vaccines, we're making them available to people. We also have a lot of persons who would have received their first dose of AstraZeneca or Sinopharm, and they need to get their second dose. Many of those persons are becoming due, and we want to encourage them to make sure they come back and get their second dose. You're not going to be fully protected unless you get both doses of the vaccine. So while it's good, and we are very encouraged by the numbers that we are seeing right now for first dose vaccination, you still have to complete the process, and that would mean get both doses of the vaccine. So if you had your first dose, make sure that you come back and you get your second dose of the vaccine, so that you can be protected. Yesterday we received the Johnson & Johnson vaccine. As you know, this has been a collaboration or an initiative that was spearheaded by the CARICOM Secretariat here, and they broke an arrangement with the African Union. These vaccines, so far, they're going to be a single dose. It is a single dose vaccine, and because the characteristics of the vaccine, it can be easily stored between 2 to 8 degrees Celsius. It makes it much easier to work with, especially in hard-to-reach communities. So we are going to send those vaccines out to those hard-to-reach communities across the hinterland, and I think that's going to help us to reach a lot of people, to be able to expand the coverage. And one of the challenges has been, when we give a first dose in one of these remote communities, getting back into the community, finding the people, because sometimes people move, it is a challenge. So by giving this single dose vaccine, at least we know people would be protected. So our strategy would be to use the J&J vaccine mostly for those remote communities that we'll have difficulty accessing. In a very limited way. Our focus would be to use it in these hard-to-reach communities. So the Pfizer vaccines, as you know, would be arriving later today. And this is a very welcome development, because we'll be using those Pfizer vaccines for persons between 12 and 18. And when the FDA approve for the other age category, which would be from 11 to 5, then we'll consider using it for that age group. But for now, the focus would be on the 12 to 18. As of last week, our numbers were relatively low, meaning that it had dropped to about 800 or so. And then we start seeing an increase in those numbers of new cases. And that is very instructive because it's telling us that we probably have a more infectious variant that is now in Guyana. And we all know that in many countries around the world, that the Delta variant is becoming the dominant variant. So Delta is now in more than 140 something countries. And as that variant becomes the dominant strain that is circulating in the country, we'll see that it's going to cause more infections. Unfortunately, it is going to cause more hospitalization and it is going to cause more deaths. Right now, because of the evolution of the virus, we are seeing that anybody who is unvaccinated, they are going to get infected. When the vaccine was first developed, it was developed and tested on adults. And therefore, we had clinical data on how it works with adults. We didn't have any clinical data or safety data for children. And that is why initially the vaccines were made available for adults 18 years and above. In the case of Pfizer, the FDA would have licensed it for persons 16 years and above. But everyone recognized with the evolution of the virus that it would infect people regardless of age. So a baby can get infected, a 2-year-old can get infected, a 12-year-old can get infected. And if they get infected, it means that they stand the risk like everybody else. They can get severe form of the infection. They can die from COVID.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.